Hi, everyone. I'm Dr. Layla, a devoted urologist and medical professor with over 30 years of experience treating men's health issues. My specialty throughout the years has been helping mature gentlemen, those in their 60s and older, navigate the subtleties of maintaining not just their sexual vitality, but also the core of their identity as self assured, connected people. You see, I've seen directly in my work how a man's sense of self may be undermined by neglecting certain adjustments. But I've also seen the significant changes that occur when he takes proactive measures. I want to reveal something that isn't often talked about publicly today. Your penis ages just like your heart, brain, or bones do. Ignoring this not only detracts from its effectiveness, but also erodes your dignity, confidence, and the close relationships that give life depth and purpose. What if I told you that the primary cause of erectile dysfunction in men over 60 has nothing to do with turning pages in a calendar and everything to do with neglected habits? What if that story could be completely changed by a simple daily practice that didn't include drugs or intrusive procedures? It's based on the physiology I've researched and used throughout my career, so it's not just hype. In this discussion, Gentlemen in Your Prime, I'll present 5 science-based tactics designed just for you. These aren't short-lived tricks. They're realistic, life-enhancing strategies that can protect your health and rekindle your passion. And stay tuned because I'm going to share a little-known extra tip that even many of your coworkers are unaware of. One that might protect you from one of the most excruciating penile disorders we see in older guys. If you're new here or haven't subscribed yet, click that button right now and enable notifications before we get started. I made these insights with you in mind, practical, age-appropriate guidance to support your journey toward better health. Please leave a comment below if something strikes a chord with you, or if you would like me to explain something. Your comments help me better serve you by influencing what I share next. Let's begin with maintaining an active penis, which may be the most misunderstood component of penile care as we age. The harsh reality is that your body begins to lose it if you stop using it. Men in their 60s or 70s who silently accept that their sexual chapter is over frequently come to me in my clinic. They would sigh and remark, "Dr. Layla, I assumed it's just a part of growing older. Nothing I can do." That kind of thinking is not only wrong, but it might hasten the deterioration, which is why it crushes my heart. Like your biceps or cardiovascular system, your penis needs consistent use to be strong. We refer to this problem as penile atrophy from disuse since prolonged inactivity causes decreased blood flow, elasticity loss, and even tissue shrinkage. Unbelievably, many men who were unaware of the consequences are affected by it. I'll give you an example from my experience. Robert, a retired engineer in his late 60s, was one of my patients. He assumed that intimacy was over for him after losing his wife a few years before and withdrew from all forms of it. He was experiencing weaker erections and visible shortening by the time he came to me. We had an open discussion, and I described the science. Sexual activity, whether done with a partner or alone, oxygenates those tissues, maintains suppleness, and retains function, much like stretching a muscle to avoid stiffness or walking every day to keep your heart working efficiently. It's fundamental biology, as evidenced by research published in the Journal of Sexual Medicine that shows older men's erectile health improves with regular arousal. It's reversible, which is its beauty. We began modestly for Robert by introducing mindful masturbation a few times per week, emphasizing pleasure over performance. It's acceptable if solo stimulation seems unattainable at the moment, perhaps as a result of arthritis or emotional obstacles. Other options include pelvic floor exercises, think of Kegels for males, that strengthen the muscles supporting circulation, or medically approved vacuum pumps that gently promote blood flow. These are about respecting your body's demands at any age, not about pursuing youth. What about the knock-on effects? Deep. In addition to regaining his physical self-confidence, Robert also made new acquaintances and even began dating. His tale is similar to hundreds I've seen. Exercise strengthens the spirit as well as the body, regaining the sense of manhood associated with experience and knowledge rather than just physical stamina. Building on that exercise base, let's go on to something surprisingly straightforward yet really powerful: good hygiene. Come on, Dr. Layla, I know how to clean myself, you may be thinking. However, I have treated thousands of patients, and I can assure you that as we age, our bodies undergo subtle changes that make the regimen of yesterday insufficient today. Immune responses slow down, our skin thins, and tiny irritations that heal overnight can persist and invite problems. For example, in men who are not circumcised, the foreskin may retain perspiration, germs, and dead skin cells, resulting in the painful inflammation known as balanitis. As seen in places like South America, where rates are startlingly high because of a lack of awareness, severe cases of persistent poor hygiene increase the risk of penile cancer. According to a World Health Organization study, these risks can be significantly reduced with basic preventative treatment. Thus, this is the tactful procedure that I suggest. Use a gentle, fragrance-free soap and warm water. Avoid using a harsh soap that removes natural oils. If necessary, carefully pull back the foreskin, then rinse well and pat dry. Moisture, particularly in skin creases, is a breeding ground for problems. Harold, a 72-year-old widower, was one of my patients. He came in with a history of infections that he blamed on old age. It turns out that his brief baths omitted these specifics, which was made worse by the fact that diabetes slowed his recovery. This regimen, together with post-intimacy or sweaty day cleanses, helped him get rid of the infections and boost his self-esteem. He remarked, "It's like respecting myself again." Just like brushing your teeth helps you avoid more serious dental problems, maintaining good hygiene is an act of self-care that radiates confidence. In a culture that occasionally marginalizes older guys, it gives you the confidence to feel new, in charge, and prepared for connection. Now that cleanliness has been established, we need to face a hidden danger that might arise during passionate moments, having an intimate relationship while only partially erected. This may sound finicky, but believe me, I've stressed it in both lectures and consults, and it's a game changer. The penis is a complex system of blood vessels and spongy tissues that requires complete rigidity for support during action. It is not indestructible. Microtears, which are microscopic wounds that heal over time, might result from pushing too quickly. Peyronie's disease is a condition where curvature makes erections difficult or sexual activity difficult. Up to 13% of men over 50 are estimated to be affected by this, according to research from the International Society for Sexual Medicine. It frequently results from accumulated trauma. During such encounters, I remember treating a 65-year-old guy named Frank who loved his busy lifestyle but disregarded early warning indications. His marriage was strained by the time the bend materialized. Prevention is crucial, but we were able to detect it early with medicines. My recommendation? You have patience on your side. Ample foreplay, wait for complete arousal, and reduce friction with water-based lubricants. Talk to your partner. The regret won't be worth the haste. Give assistance, such as ED drugs, time to do their job. This is intelligent body stewardship that ensures pleasure is joyous and sustainable, not fragile. Knowing this earlier would have saved me heartache, Frank subsequently told me. Let's see to it that yours is saved. Moving from physical protections to mental health, let's address a contemporary problem: excessive use of pornography. It's more accessible than ever in our digital age, and for many lonely or bereaved men over 60, it appears to be a harmless way to express themselves. However, having given a lot of advice on the subject, I can understand how it might quietly undermine sincere closeness and desire. The reward circuits in the brain are rewired by excessive viewing, leading to desensitization to the point when interactions in real life seem insignificant. Heavy porn use is linked to erectile dysfunction in otherwise healthy men, according to a groundbreaking study published in JAMA Psychiatry. This creates a vicious cycle of frustration. I have seen patients like George, a 68-year-old veteran who acknowledged that his long-term spouse's responses were blunted by his habit. The emotional tolls of aging, such as retirement blues or health scares, added to his feelings of brokenness and humiliation. My guiding is empathy. I'm not here to shame. Rather, I support moderation. Consider it a garnish rather than the main entree. Use sensory touch, emotional bonding, or fantasy to rediscover your natural arousal. George found passion again, cut back, and spent money on couples therapy. By balancing mind and body for more meaningful, satisfying relationships that respect your maturity, limiting porn is not deprivation, but release. Last but not least, the foundation is putting lifestyle decisions ahead of temporary solutions. In my more than 3 decades of experience, I've discovered that no medication can replace the transformational potential of everyday routines. Your overall vitality is reflected in your sexual health. Erections depend on healthy blood flow, hormone balance, and mental clarity, all of which are impacted by your lifestyle. Smoking narrows blood vessels, drinking too much alcohol depletes testosterone, and eating poorly clogs arteries, all of which support research published in the New England Journal of Medicine that suggests erectile dysfunction frequently portends cardiac problems. However, reverse the script. Within weeks, quitting smoking improves circulation. Nitric oxide is increased by moderate exercise, such as brisk walks for improved erections, and vascular health is supported by nutrient-rich foods such as leafy greens, berries, and almonds. Michael, 70, a former smoker with hypertension and a waning libido, was an inspiring example. We concentrated on his routine: daily 30-minute walks, Mediterranean-style meals, and improved sleep, instead of prescribing more medication. His ED improved, his energy level skyrocketed, and he broke free from dependencies in a matter of months. He smiled and said, "I feel like me again." Living a lifestyle isn't a chore, it's regaining control and demonstrating how eagerly your body reacts to attention. Now for the promised bonus, think about going sans underwear to sleep. It may seem insignificant, but tight clothing can impede nighttime erections, which are essential for tissue health, and run the risk of irritating or damaging Peyronie's. According to urology journals, choosing loose boxers or nudity permits unrestrained repair. After experiencing some mild discomfort, Alan, a 62-year-old patient of mine, adopted this and reported improved function and comfort. Little habit, large reward. These tactics, gentlemen, maintaining an active lifestyle, practicing good cleanliness, engaging in safe intimacy, consuming media in moderation, leading a lively life, and releasing sleep, are not just medical advice. They are reaffirmations of your value that restore your dignity in your story. I've helped many men just like you regain their confidence by embracing empowered aging rather than striving for youth. It's never too late if you felt marginalized. Your body awaits you if you begin now. I appreciate you being here, and let's continue our discussion. This care is what you deserve.